good afternoon. It is 12 o'clock and we would like to welcome you. Those of you that have joined us on the Zoom webinar or the YouTube, we'd like to welcome you to our 10th webinar, the Flint Community Webinar on coronavirus. And this is a wonderful opportunity for us to share with you today. You'll be hearing from some of our great Flint partners, Flint Genesee County partners who've been working diligently to ensure that services and programs are available to our community and we understand how to properly access them. I'm your host and moderator today, Yvonne Lewis, and I am coming to you as a co-director of the Flint Community, the Healthy Flint Research Coordinating Center here in Flint. It is a collaboration between some community partners, Michigan State University, University of Michigan, Ann Arbor, and Flint campuses. And we're excited to be able to work together to bring this list, this amazing list of panelists that you'll be hearing from today. For those of you who have joined us for the first time, we're glad that you're here today. And we want you to know that as you look down at the bottom of your screen, and all of our screens may be a little bit differently, so look at your screen. And if you see a location there where you can put in some questions, we will be happy to entertain those questions for you today. So we want to be sure that you put those questions in. As we move forward, I'd like to just let you see a list of the panelists that are on today. Our panelists are a variety, as I said before, of community agencies and organizations that are working every day to ensure that we have the most up-to-date and relevant information that we can share with you. I know a number of you are community health workers, navigators, working in various places to ensure that you're providing services to the community. And many times you get questions, and particularly in this time, we're trying to make sure we have a local context to what's happening as it relates to the impact of the coronavirus. So you see the organizations here. We got some great updates for you today. We're excited to have a special, one of our newest panelists today. There's been many questions about what happens to our community members, and we call them vulnerable populations, some that have shelter issues, providing some additional resources. And there is an organization called Metro Community Development. And today we have with us Tracy Jackson, who is one of the VPs at Metro Community Development. And she's been working for a month, I guess we're almost 2 months in now. And for a while they were having phone calls, it felt like every day, trying to determine how this would work. So the continuum of care is something she's going to share with us today. So we'd like to welcome you today, Tracy, to share with us what is going on at Metro Community Development and how can the services that are being made available be accessed by our community members. Tracy, I think you have to unmute yourself.
Thank you, Yvonne. I was somehow I lost my connection. So I had to get back on. So I apologize for that. Thank you for the invite. As you stated, I'm Tracy Jackson, one of the VPs at Metro. Metro is the lead and collaborative applicant for the Flint Genesee County COC. The Flint Genesee County COC has a governing body. It's called the Governance Council, and we do have a chair. And that chair, her name is Essence Wilson of Communities First. She was voted in on April. So let me update the community on what's been going on with the Flint Genesee County COC. We started our meetings, and really we started with the emergency shelters, which have done a phenomenal job in making sure our homeless clients are safe. They were contained, and two of the emergency shelters, that would be Shelter of Flint, MBK, have just recently partnered with Brian Sawicki. They had all of their staff and all of the residents at those particular shelters. They have all their testing has come back negative. So that's great news. It's a testament to the CEOs and the executive directors really did a great job at implementing swiftly the CDC recommendations of cleanliness and distancing. So what we found is that they've been safe, they're contained, and they have been COVID-19 free. We're still waiting on results from Carriagetown Ministries. So that's what's going on with that particular piece. We also have been, while the emergency shelters, because of some of the requirements of the CDC, there were capacity constraints. And there was, of course, the governor's stay in place. So what the coordinated entry team did, and coordinated entry is where anyone that's experiencing homeless would enter coordinated entry, and then we will determine what housing path. So for those that, during that time, we would put them in hotels if they were seeking to be sheltered. We would put them in hotels because there was no capacity in the shelters. We would put those, so from March 16th until this date, we have helped 23 people staying in hotels. In those hotels, we have partnered with street outreach, the COC street outreach team. We've partnered with the PATH outreach team. We've partnered with Crossover to provide meals. We do check-in calls with those teams, with those people located in the hotels. We typically try to, and as the shelters were opening up, we would then try to encourage those clients to go into the shelters. But for those clients that are known vulnerable clients, we did continue to keep them in the hotels because based on the CDC recommendations, them being vulnerable, we did not want to put them in that environment. Also, we have also taken people and tried to move them into a more permanent housing situation. So it could be permanent supportive housing or rapid rehousing. Rapid rehousing is time bound, either from 6 months to 2 years, depending on what program it is providing the funding. So since this pandemic, and really more specific to March up until this date, we have housed 19 people. Some of them have come from the shelter, some have come straight from the hotel situation. How people get in contact with or want to enter into coordinated entry, there is a number I will give everyone. It is 810-544-HELP. 810-544-HELP. So we have come alongside, we have engaged the Emergency Operations Center. We've engaged with the Health Department, the Governor's Office. We have really, as a continuum, tried to make sure we connected with and collaborated with all of our community partners, not only from a housing standpoint, but also those wraparound services, whether they're behavioral, mental, physical, any of those kind of things. And that is my report. Is there anything else you need?
Well, Tracy, I do want to go back to that number because you gave us the letters HELP, and I'm looking at my own keyboard here, and I don't have letters on my keyboard.
Okay, let me pick it up real quick. Okay.
Yeah, so I want to go back to that, but I also want to just have you emphasize how it has been important for this coordination. You mentioned the collaboration that's happening between Metro, because a lot of people really may not fully understand the work and role of Metro Community Development, but it's extraordinary how you, in a short little bit of time, when there was concern about the homeless population, particularly, and those who are needing special shelter conditions, were being serviced, and talking about what it took to get those activities done.
Okay, so really the work has been done with the shelters and the mental, the medical providers. They did the help. What Metro really did was we are the coordinating body. We pulled everybody together so that we could understand what is going on in our county and how to best approach it. So it really is, all of our partners are doing really great work, and we're bringing everybody together. Now, our piece is more on the coordinated entry side, which of course is a COC program. But our role has been to make sure everybody's talking to each other and that we know what's going on and how to best protect our clients and make sure they're getting the services that they need while making sure we're moving them towards self-sufficiency.
And that's where I was going next. So I appreciate you giving that segue for self-sufficiency when you talked about the permanent housing the piece, because there are people who are in some really shifting situations because of the times. They've lost their job and so forth. And we know there's a stay of eviction, but that isn't happening for everybody. So being able to know that they can contact your office is extremely important, especially for those of us who are helping others who may not know. So if you could give us that number once again.
Sure. And also, as it relates to, we did write a grant for the Greater Flint Urgent Relief Fund. We are also able to help people that find themselves not able to pay their rent. Of course, there's some specific requirements that we need, but we can also help them recover there as well. And that would be, they would call that 810-544-HELP, and the HELP is 4357. 4357, 810-544-HELP. And if they don't know what to do, have them call that number and we will connect them to the right resources in the community.
And so this is extremely important. Again, when we look at the participants in our webinar, so many of us are talking to others because that's our role. We're community health workers, we're navigators, we're first line individuals. And so for us having this information, then sharing it so we don't have to have anybody in our community that doesn't have services and resources that need them.
Thank you. And we've had resources from every corner of the community. I just want to say thank you to the community. Pretty much everyone on this call have had some kind of connection into our helpline, into coordinated entry. And so I just want to thank the community for getting your clients connected, helping us to stabilize them and work with them to get them moving them towards self-sufficiency. So I'd like to say thank you to the community for what you're doing to take care of your clients.
Thank you, Tracy. And you're going to stay on the line with us as long as you can. In case there are other questions, I want to remind our listeners that you can go to the Q&A, put your question in there, and our panelists will be happy to answer those questions for you today. So thank you again, Tracy. You pointed out something really, really critical. Each one of us have our own particular roles, but we come together to make sure that the needs of the community are met as a whole. So one of the big ways we do that is to talk to the City of Flint. And today we're looking, excuse me, to hear from Brian Larkin, who is the Chief of Staff for the City of Flint. And excuse me, I'm looking to make sure that Brian's on the line yet. I know he's been really, really busy. But if not, I'm gonna just switch over and pull up Dr. Reynolds to talk on behalf of the City of Flint and give us updates. We know that there is some plans on reopening, and there's a process being put in place. We heard Brian Larkin say last week that there was a Blue Ribbon Committee. Not sure if we have all the details on that, but Dr. Reynolds, can you give us an update? Because this is a real concern for us, is what's the plan for our community? Dr. Reynolds. I hear his mic is unmuted, but I don't hear his voice.
Thank you. We are entering the flattening of the curve phase, which means the rise in cases is slowing down, the number of deaths is slowing down, and this has been for about 10 days. However, this doesn't mean the battle is over. What it means is we are in the middle of the battle. So we are trying to open up the city and especially the municipal buildings and services in phases. And so we are meeting to discuss that now. And as as you know, in this situation, you have a plan and something comes up and you must change the plan. Some of you may have noticed last week we had to close our service department on the first floor. When you walk into City Hall and turn left to pay your bills or your taxes, it has been closed. And that is because we are not immune to COVID-19 either. So we have staff who are either isolating or being cared for. And unfortunately, we have had one death. So I bring this up so you all know that this is serious. And so when people say, well, I'm going to go to the beauty parlor anyway, I'm going to get a haircut anyway, I'm going to the bar, or we're being oppressed because we can't do these things. These are matters of life and death. And so we are cautiously moving forward. We will be following the lead of the governor and the county, but I should advise you all, because we are a hot spot, particularly in Flint, we may continue with more stringent guidelines than the rest of the state. So please be patient with us. Please cooperate, because we are only doing this to protect the health of our residents and our neighbors. So thank you.
Thank you, Dr. Reynolds. And we want to remember to, as you see on the slide, if you need some assistance, be sure to call that number 410-2020.
And that number is still open.
Yes. And Dr. Reynolds, you mentioned something. You said that the city was following the state. And I think this is very important. And so one of the things that—
as a minimum, I should be clear.
Yeah, at a minimum, but with an eye on what's happening here in our local community. That's why this conversation is so important. And one of the things is the curfew. If you could just touch on that a little bit, because that's important.
Please, our curfew will continue through the 28th of May. And hopefully we won't have to extend it, but I want to commend the residents of Flint, because of this curfew, we have been able to continue with social distancing and with wearing our masks and staying at home and avoiding unnecessary trips. And with this curfew, we have been able to flatten the curve as much as we can. So this is just part of a process to protect the ones we love and our neighbors. So
thank you.
Okay. Thank you.
Thank you, Dr. Reynolds. We appreciate that. And so since we're talking about following the governors as we can, based upon what's currently happening, we had some requests to talk a little bit more about that. Gary Jones, who is the community affairs representative for Flint and out of the governor's office, is back in the webinar with us today. And so we're just going to ask you, Gary, if you can give us some updates, because again, we are working collaboratively, doing our best to make sure we stay in alignment as much as possible with what the governor is recommending. So Gary, can you bring us up to speed on what's happening at the state level?
Yeah, sure thing. And thanks also to Yvonne. So I always start out my updates, just giving sort of the data, the latest that we have. This data is updated every day at 3 p.m. on the michigan.gov/coronavirus website. But as of today, so far, we have a total confirmed cases statewide of 53,510 positive coronavirus cases. Total COVID-19 related deaths are at 5,129. And total number of recovered COVID-19 cases as of May 15th are now at 28,234. And just as a note, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So recently, folks saw that the governor reopened auto dealerships and retail businesses by appointment and authorized non-essential medical, dental, and veterinary procedures. So via an executive order, reopening of retail businesses and auto dealerships by appointment statewide will begin Tuesday, May 26th, as part of the governor's My Safe Start plan. And the governor's executive order also lifts the requirement that healthcare providers delay some non-essential medical, dental, and veterinary procedures statewide beginning Friday, May 29th. The order also authorizes small gatherings of 10 people or less starting immediately, as long as participants practice social distancing. The governor also signed the executive order enhancing and expanding protections for residents and employees of long-term care facilities. So this extends and further enhances protections for the health and safety of residents and employees of long-term care facilities. The order takes effect immediately and will continue through June 17th. There was also an extension of an order permitting early refills for up to 90-day supply of pharmaceuticals, and also relaxing regulatory limitations on pharmacy operations. So by extending her previous order, which gives pharmacists increased operational capacity and expands access to prescriptions for Michiganders who need them. The governor also signed an order expanding worker protections as Michigan re-engages sectors of the economy. So this order requires all businesses to adhere to strict safety guidelines to protect their workers, their patrons, and their communities from infection. And in order to foster compliance, the governor appointed a director of COVID-19 workplace safety within the Department of Labor and Economic Opportunity. The governor also reopened retail, restaurants, and offices in the Upper Peninsula and Traverse City regions as well. So by allowing for the reopening in 2 regions of retail businesses, office work that cannot be done remotely, and restaurants and bars with limited seating, those 2 regions are both in the northern part of the state, specifically the MERC regions 6 and 8, as detailed in the governor's My Safe Start plan in order to re-engage Michigan's economy. The governor also extended an order temporarily enhancing price gouging restrictions during the COVID-19 pandemic. So by further extending enhanced price gouging restrictions, it allows for extension on restrictions of excessive pricing of goods, materials, emergency supplies, and consumer food items. The new order took effect immediately and will remain in effect until June 12th. The governor also announced a process to chart a path for the safe and equitable reopening of schools. So this announcement was a creation of the Return to School Advisory Council via the executive order, by formalizing a process for determining how schools may be able to reopen in the fall. The governor also extended an order temporarily suspending evictions. So this temporary extension provides protections for tenants and mobile home owners from being evicted from their home during the COVID-19 pandemic. This order also took effect immediately and will continue until June 11th. There was also signage of an order extending capacity for disaster relief childcare services for essential workforce. So this continues the expanded access and capacity for childcare services, giving priority to essential workforce, and the extension lasts until June 10th. There was also signage of an executive order expanding telehealth options for Michiganders. So this expansion of telehealth options authorizes and encourages healthcare providers to use these services when appropriate and after getting consent from their patients. This order also took effect immediately and will last until June 10th. There was also signing of an order providing relief from tax appeal deadlines. So this provides an extended opportunity for individuals to dispute the assessed value of their property. And also, Michigan financial institutions have been urged to protect customers' COVID-19 economic impact payments. So both the governor and the Michigan Department of Insurance and Financial Services issued a bulletin strongly encouraging financial institutions to protect customers' economic impact payments from overdrafts and fees. Institutions have been strongly urged not to access customers' stimulus payments in order to satisfy overdrafts or overdraft fees, ATM fees, or late payment fees, so that folks in Michigan can use those funds on important living expenses. And again, to stay updated on everything, michigan.gov/coronavirus is updated daily. So that's the best place to catch all updates.
Thank you, Gary. That's a lot of information that you shared. So I'm glad you gave us I'm glad you gave us that website. And just to know that the governor has been using this phase process. She's looking at trying to control the growth and persistence of the spread. And as Dr. Reynolds mentioned, we're kind of in a lot of places in the flattening of the curve. So this is why some of these things are being released. But I think it's important that we all continue to pay attention to the fact that we are in a crisis, and there are some things that we must continue to do to stay safe. And Gary, we appreciate you too. We had a slide up that spoke about the eviction. So we just wanted to remind the listeners about that stay of eviction. And so if they need this number, as we show it on the next slide, please make sure to jot this email address down about the eviction so that everybody will know about that. So that's going to come up as well. So thank you so much for that update, Gary, and we look forward to hearing more updates as we move forward further. Now, as we're talking about the reopening of our community, there have been a lot of questions about, well, how do we know that we're going to be safe? And one of the committees that has been established there's been a lot of work being done. We have a work group called contact tracing. It's hard to get it all out. So Kirk Smith is on with us today. He broached this subject last week. We're gonna talk a little bit about that. I apologize, I need to take a step back. I do see Sharonda Griggs be on the line. We want to just give a quick update from the state again out of the Office of Equity and Minority Health. So Sharonda, before I go to Kirk, can you give us that quick update?
Yes, thanks, Yvonne. Good afternoon, everyone. I just wanted to provide a quick update. As I reported in previous calls with you guys, that we're working closely with the Health Disparities Task Force that was established by the governor. And our priority for that task force, we're leading that work group on the testing strategy for vulnerable and marginalized communities. So the update that I have today is that we are looking to partner and with 20 communities, community-based organizations, churches, et cetera, to expand testing. On 5/13, on May 13th, the state did release an RFP seeking bid proposals for turnkey vendors to help with the standing up of those community testing sites. And those turnkey vendors are able to provide registration. They provide medical support, testing supplies, PPEs. They'll be available to return lab results. And we're looking to stand up 20 neighborhood-based testing sites and 6 to 8 large drive-through testing sites. The proposals were due for those vendors on 5/18, and they're currently being reviewed, and we're looking to select a vendor next week. In addition to that, I just wanted to report that we have finalized a hosting for 3 brick and mortar COVID testing locations in Genesee County, at Beecher High School, which is in the 48458 Neff Road, the Word of Life Christian Church, 48507, which is on Atherton Road. And then we finalized Burston Field House as a testing site, 48505.
Okay. Thank you, Sharon. And we'll hear a little bit more about those sites as well when we have our local update. But we appreciate the state being willing through your office to come on and keep us updated with those key changes and improvements to how our community accesses testing. So that does lead us to our next conversation, because once testing is done, something else has to happen. And so there's been a lot of work around this. There are a lot of questions and concerns. So Kirk Smith has been working as a co-chair of the work group committee for the contact tracing for our local community. So Kirk, you started this conversation with us last week. Can you just give us an update and a little bit more detail on how this process is working for our community?
Hi, Yvonne. Sure, happy to do that. And I also know that Kim Van Slyke from Genesee County Health Department is here as well, and will sort of help me tackle this topic together. Contact tracing is really just conceptually is a public health disease control measure that has really been used by local state public health agencies for decades. It is very relevant to preventing further spread of COVID-19. And while it's not a new concept, it is new to many of us. And so I think what we really want to try to do is explain what it is and how it works, as well as who's working on it in the community. At a high level, contact tracing is part of the process of supporting a resident or a patient with a suspected or a confirmed COVID-19 infection. So what happens is public health staff work with a resident that has had a positive COVID-19 test to help them recall anyone that they might have had close contact with during the time frame while they may have been infectious. The public health staff then reach out to notify, warn, engage any individual who might have been exposed to those individuals who had had a positive COVID-19 test, so that they can be informed as quickly and as sensitively as possible that they've been in contact with somebody who's had a positive case. Now, to protect privacy, these close contacts are only informed that they may have been exposed to another resident. They're not told who, they're not told when or where. The real goal is around education, information, and support. So anyone who may have been into contact with someone that has had a positive test, to understand their risks, to know what they should do, how they can monitor themselves for illness, and really help them to consider that even if they don't feel ill, what they could do to potentially stop the spread of further infection to others. As you stated, there is a local working group that was created between Genesee County Health Department and many of the members of the Greater Flint Health Coalition to start to build up the volunteer workforce to aid our local health department in completing these contact tracing outreach calls to our residents. The members and the partners of that work group include the City of Flint and the health advisor, Dr. Reynolds, who we heard from earlier, the Genesee Health Plan, Michigan State University, especially the medical students, Genesee Health System, Wellness, New Paths, the United Way, as well as the Genesee CHAP program of Greater Flint Health Coalition. I think what we also wanted to do today, if I could hand it off to Kim Van Slyke, who's the nursing director at the health department, is really give the audience an idea of what residents should expect if they get a call. And Kim has done an excellent job not only building up that workforce in collaboration with the partners, but she really leads this work on behalf of the health department as their nursing director.
So Kim, you're up on the next slide. If we can leave this slide up if you need it. But Kim, we appreciate you, and you can let us know which of the slides you want to work from. But Kim has been very instrumental. And so there were some really specific things that were raised as how do we know when we're getting a call, and how should the residents also respond? So Kim, can you just take it over now and give us the clarification of just how this will work?
Yes. Hi, Yvonne. Thank you again for inviting me today. And thank you everybody for the wonderful work that you're doing with these webcasts. As Kurt said, this is not really a new concept. This is part of outbreak investigation, which we do for any type of communicable disease or infection. We've done this with HIV and foodborne illness or food poisonings through restaurants or exposures for years. So nothing new, really, just new to us, new to a lot of people maybe, and new, of course, to COVID-19. So just also to kind of bring it into perspective, what happens and where it fits into the steps of our process. So first, we are notified that there is a person under investigation or somebody who has received a test is maybe symptomatic. And then we get results, either the test was negative or positive. If the test was positive, then they will receive a call from one of our team members asking several questions about what's going on with their symptoms. Part of this is some personal information, verifying their identification, their date of birth, their phone, their address, just like you would if you went to the hospital, because we want to make sure that we're talking to the correct person and that we're not sharing health information with somebody who we shouldn't be sharing personal health information with. So we have to check your name, your date of birth, your address, your phone number, all of those things. We want to know when the symptoms started, what type of symptoms, how long has it been going on, Who have you been around? This is where the contact tracing comes in. When you identify, if you were the person that tested positive or were symptomatic, and you identify the people that you have been around, those are the contacts that we then put into the system, and the state pulls out of the system to be put into this contact tracing program that we are collaborating and cooperating with them for. So with our contact tracing, as Kirk said, we can't tell you who exposed you, who you were exposed to, because that's their personal health information. So just like we wouldn't share your information, we're not going to share their information without their permission, and we don't ask for that permission. So we will tell you, you'll be contacted by someone from the state. We are collaborating with the state. Our group of volunteers that Kirk has helped us coordinate are going to be designated to help people from Flint and Genesee County so that we have local community members working with our local people. They will also verify your name and verify your birth date to make sure that we're speaking with the correct person, because we don't want to share your health information with someone we shouldn't be. They will ask if you have symptoms or if you have any other health issues that could potentially put you at a higher risk for developing COVID-19. They will ask for your phone number and your address in case we need to do further follow-up with you. Part of that follow-up is that they follow you for 14 days from the point of contact, which we don't, everybody is just automatic for considered 14 days. So they will want to talk to you and ask you how you're doing and follow up, have you check your temperature, check to see if you're developing any symptoms, and see if you have any questions or any new concerns that have come up. And they'll do that for 14 days. They will want to speak with you either by phone, or we do have the option of an automated texting service. So you can do it by text message as well as by phone. So again, we're partnering with MDHHS, which is the state's program for our contact tracing. It's local Flint and Genesee County volunteers working with the state process. They are making calls 10 a.m. to 7 p.m. 7 days a week. So you could potentially get a call any day of the week between the hours of 10 a.m. and 7 p.m. If you get a call from the state, as Kirk has mentioned before, the caller ID will register MI COVID Help. So Michigan COVID Help or My COVID Help. So if you see that call coming through on your caller ID, please pick up the phone. We are just trying to help you, trying to educate you, trying to make sure that you're connected with the resources that you might need, and answer any questions, get you connected with testing if you need testing, or with a primary care provider if you need a primary care provider. Some of the information that we're able to get you can be very helpful. On the other hand, if you're getting a call for a case investigation, if you're the person who's positive, then potentially the caller ID, if the person is calling from the health department, could say GCHD scrambled with a number sign. Unfortunately, because of all of the social distancing and everything that's going on in our community, many of the Genesee County Health Department employees are calling from home, and so, or working from home rather. So they're calling using their own personal cell phones. Many of them have downloaded calling apps like Google Voice. And in that case, the caller ID may not show up as GCHD. It will likely just show up as a local number. So I encourage you, even if it's a number that you don't recognize, to please take a moment, answer the phone, screen the call. If they're telling you that they're calling you to contact you about a positive test result, or that they're calling to inform you that you have been exposed to a positive COVID patient, ask them a few questions. Try and verify where they're calling from, see if they sound authentic, if it sounds realistic, and then try and answer their questions. If for some reason it doesn't seem authentic, or if you're very suspicious of what is going on, we do have a COVID helpline here at Genesee County. And that's a number that you could call to verify that this actually was a Genesee County employee. I'm going to read the number to you a couple of times, and this is the Genesee County COVID-19 phone line. It's 810-424-4443. Again, that number is 810-424-4443. So that number is our COVID helpline, but you can also use it to verify if the phone call you're getting is actually a Genesee County employee. So that's what I have put together. Yvonne, is there anything that I missed or anything else that you would like to know?
Thank you. We're going to put some of this additional information up, but I do think we want to come back and talk about the number again, just to clarify. I know we're still doing some work on trying to make sure people are comfortable, but one of the things that we discussed in another conversation is people should not be giving out their financial information on these calls. They shouldn't be asked about their birth dates or anything like that. So if you could just talk.
Birth dates, yes.
Okay.
We use birth date just like in a hospital as identification verification. So we'll ask their name, their date of birth to verify that we're talking to the correct person so that we can share that health information and collect that health information. The other information that we likely will ask is a phone number and an address.
Okay.
But we never ask financial information.
So I think one of the things is for those that are listening, because we get a lot of questions on this, we just may have to take another webinar and go into this more in detail, because it is a matter of importance, but it is also a matter of safety. People are concerned about getting erroneous calls and not being sure how to respond to those. So we want to thank you for the update you've given today, and just let our listeners and our participants know there will be more information. So stay tuned for future webinars. And then we encourage you, put those questions in. As you've heard these presentations today and they raise questions for you, put those questions in so our panelists can be busy answering those for you. Another quick update from the health department, as we're talking about contact tracing, there's continual testing going on. You heard Sharonda from the state talk about new sites. Suzanne Cooper has been really, really instrumental in making sure we understand what's happening here through our local health department. Suzanne, can you give us the most recent updates for our community?
Yes, so as of today, we have 1,931 positive COVID-19 test results and 238 deaths. And as we always remind you, this is reflective of the positive COVID-19 tests, not likely reflective of all the positive COVID-19 results and tests results in our community. Again, just testing, not reflective of the cases that are likely in our community. So again, we are recommending testing for everyone who qualifies. Remember that the testing criteria has expanded to now include those that are non-symptomatic essential workers. So now they can get tested as well. As we shared with you, Walmart on Coretta Road in Flint is the newest site to come up and running. They are open from 7 a.m. to 9 a.m. Monday, Wednesday, and Friday by appointment. We also have the Rite Aid in Swartz Creek. They're open daily from 9 a.m. to 5 p.m. And the Flint Clio Road Rite Aid is open. They have more non-traditional hours, Monday through Friday, 10 a.m. to 8 p.m. to allow for people who work to be tested as well. Saturdays and Sundays, they are open from 10 a.m. to 5 p.m. Kroger's assisting with Grand Blanc High School's location. That's in the school parking lot. They are open Monday through Thursday, 10 a.m. to 4 p.m. And Michigan Health Specialists are available. They have two locations, one in Burton and one in Flint. They're Monday through Friday, 9 a.m. to 5 p.m. by appointment. Just a reminder that Genesee Health Systems is assisting in our community with testing in group sites. So their work is not open to the public, but it's critically important because they are visiting group homes, assisted livings, shelters, substance abuse treatment centers, etc., and getting testing done in those locations. So they're doing, again, critical work, but they are not open to the public. And then, as you all know, that Hamilton Community Health Network clinics are providing testing at North Point Clinic and at the Burton locations Tuesdays and Thursdays by appointment. And Hamilton's also now offering the antibody testing, and I'll let Clarence talk about that in just a minute. As you heard, we are continuing to work on other locations, bringing them online. As we do get them online, we'll be providing you additional information, so stay tuned. We will be bringing that as soon as they're up and running. I want to remind everyone that though the McCree South building of the Health Department is closed to the public, our staff are still available. They are still providing service, so please don't hesitate to reach out for any of your critical needs. Also, our Burton Clinic is open by appointment for WIC, family planning, immunizations, and sexually transmitted infection testing. So please call and make an appointment, and you can receive your service there. So I want to pass it on to Hamilton and Clarence Pierce so he can share a little bit more information about what they're offering for antibody testing.
Yes, good to be with you again, Yvonne. Yes, we are providing testing at 2 of our locations, up at our North Point clinic. We're doing mobile testing as well as in-clinic testing. And we're also doing testing at our South location, Burton Clinic, both again, clinic and mobile. And as Suzanne said, we are doing 2 tests. We're doing the nasal swab, but we're also doing the antibody serology test. And what we've noticed is a few more people are starting to request that test. But I think, you know, we've got to understand that the nasal swab test is a test that will tell you whether you're positive or not within 24 hours of taking the test. Whereas the antibody test, it doesn't tell you whether you're positive at the time, but what it does is it tells you whether or not you have been exposed to the virus. And that means that you still could get the virus and become positive even after taking the antibody test. But I think that some people may not quite totally understand the 2 different tests. So if you're concerned about whether or not you're positive or not, you should get the nasal swab. But if you're just concerned about whether or not you've been exposed at some other period, then you would want to get the serology test. So that's kind of sums it up for me.
Right. So Clarence, thank you so much, because again, as we're in these conversations, there's so much detail that we need to share, and we don't have enough time to do it all in 1 hour, but we thank you for raising these issues to clarify. So we'll look forward to having some more detailed discussion in future webinars. But the point is, people do need to continue to get tested.
Yes.
I have a couple of questions in the queue for those who have already spoken, and then we'll have Dr. Deborah Holden's going to come and talk with us. But one of the, excuse me, one of the really important questions that came up, and Clarence, you talked about it, but quickly, if a person is using another site to get as their primary care, can they still come to Hamilton and get the testing?
They can. Now, we do require them to call and make an appointment. And we have that Hamilton COVID-19 hotline, and that's 810-406-4019.
Okay.
So you just call that number. And the purpose of that, Yvonne, is for the provider to, one, kind of diagnose your situation and give you some education about the test itself, so that you're not totally unaware of what's happening when you go and have the test done. So as long as you call and get the appointment, then you're all set to come in and get the test.
Thank you. This is a quick question for Tracy. Tracy, what is COC? We know.
Oh, I'm sorry about that. That is the continuum of care.
Okay.
Sorry.
That's okay. That's okay. And then this question, is there something going to be put in place as far as numbers if we are open and the numbers are beginning to increase for COVID-19? So the question is, if the numbers continue to increase, will everything be shut down again? And I think this goes back to you, Dr. Reynolds. Will everything be shut down again? It could be you or you know, it's from a statewide perspective. I know the governor's looking at the step-by-step, but what say ye?
I will tell you this. This is not a decision that will be made in isolation. We will talk with our county health department. We will talk with our state health department. And I assure you, if we see an upward trend, if we see hot spots, we will definitely have to consider backing down. So as we move from phase to phase, this is not a steady progression from phase 1 to the end of everything. At phase 6, we may have to backtrack, and we may have to insist on sheltering in place again. So please understand what I'm saying. This is not a straight through process, because we are in the middle and we don't know what the next parts of this crisis will bring. And I'll be glad to hear from the state and our county health department on this also.
Thank you. And I think we'll have to come back to that, but we're going to know that there's going to be some coordinated effort on that. I want to go to Dr. Deborah Verholden. Dr. Verholden, you're sitting in a number of seats. The Michigan Corona Task Force. You're on the local task force for racial disparities, and we have just a tremendous amount of questions about all the information that's being shared. I'm just going to ask you, based upon what you're seeing, what are some key tips that you want our participants to understand as we're talking about all of this today?
Well, there's a couple things. The first is that, you know, I've been really, just really impressed and moved by the, you know, sort of rallying of what's been happening in Flint with our providers and our, you know, agencies and our, you know, coming out of the mayor's office and the health department. And I realize it's a lot of information coming at people, and that some of that information is hard to sort of decipher and then also to act upon. So I just wanted to, you know, for 1 minute touch on, and I am watching the clock because I know you start on time and end on time. The two things that have come up is one, this issue around gloves. There are a lot of people who've been told to wear gloves. And the thing that I want to caution people about is, you know, the ideal goal is that people limit their exposure out in the community. So we don't want people to be living in fear, right? What we want, though, is for people to practice good safety. And so if you put on one pair of gloves and you leave your house and you go to 3 or 4 different locations and you have those same pair of gloves on, if those gloves become contaminated, what happens is everything that you touch with those contaminated gloves, you're just spreading the virus potentially. You could even reinfect yourself. So if you go into a store and you touch the cart with your hands, and then you don't take the gloves off when you leave the store, and you open up your car door and you put your seatbelts on, and then you drive your car with those gloves, and then when you get home, you take the gloves off, you've infected your car door handle, your seatbelt, your steering wheel. I understand that people have been given recommendations, as an example, to wear gloves, but those gloves are only meant for short duration in a particular period of exposure, like while you're in the store. It would be much better if people were ungloved, but sanitizing their hands when they go into a place, when they leave a place, before they get in their car, and before they come home. And then, of course, to just continue with the basic practices of, you know, cleaning down surfaces. And that includes surfaces that you touch when you're in your vehicle. So wanted to just take a second to kind of pick one topic you know, each week that seems to be coming up out in the community. Another big issue is around testing. I don't think we'll have time to do that today. And Dr. Reynolds can also speak to this, but people have heard there are basically 2 tests on the market. One test for the presence of the virus and one test for antibodies for the virus. Both of those tests have utility and both of them can be useful for us understanding what is the extent of the problem in our community and what, you know, inform us on how we can better protect and serve the health of our residents. I'm happy to table that for a future conversation, but I appreciate having the opportunity to just give a little bit more insight on some of the recommendations that people are getting. And I'm happy to stay on a little bit longer and answer questions that people post in the Q&A, or we can, you know, give people a chance to make sure that this is clear for them and that they understand.
Yeah. Thank you, Dr. Deborah, because you are kind of helping us. We're going to be studying some future webinars, and some of these conversations we will have to go more in depth in. So thank you for that tidbit today, because I know that was just a little bit of time. We have 2 major things. So we know that our local task force is running through the Community Foundation, but we're going to move past that for today. And I want to get to MTA as our community update. MTA has some updates for us, and we saw the big bus starting to roll. So this next minute or so, and we'll give you more time next week, we promise, Harmony, but can you tell us where we are quickly for MTA?
I will. So the big news is that our fixed route buses, so the big city buses that you see, are back running. We had shut down for 50 days, and that was the first time we had in 50 years. So it was huge, but we are so happy to be running, and we are requiring masks. We have them available on the bus and at the transfer center. People have been wonderful and following the rules and social distancing on the buses. You may see 2 buses right in a row, and that's so that we can allow for people to social distance when they're on the bus. And we are running fare free until the end of May, and then we'll make another.
You said fare free, right? So you're not charging people to ride the bus?
Right. No,
Okay.
Not charging people to ride the bus right now. So until June 1st, it is fare free, and we ask people that they enter the rear of the bus, so they're limiting their contact with the driver. On June 1st, we'll make another announcement related to fares and how that will go moving forward. And then just quickly, Your Ride is fully operational and running as usual. And Rides to Wellness, which I know many of the people on this call have clients or are involved with, will be fully operational on Monday, June 1st. And we will be requiring masks be worn on Rides to Wellness, and it will be absolutely required. If somebody refuses to wear a mask, they will not be allowed to take a trip on the Rides to Wellness vehicle. So that's all I have right now.
Thank you, Harmony. Our next big update is going to be from Consumers Energy. There was a new program. Kyle, can you give us quickly what's happening with the free thermostat?
Yes, I can very quickly. Consumersenergy.com/free thermostat. We announced a program earlier this week to give away 100,000 Nest E thermostats to customers across Michigan. This is for gas, electric, and combination customers. Most emergency county customers, of course, are a combination. The only cost is sales tax and shipping. I think that's $15. The units normally list for about $150, so it's really good value. Get you signed up in our demand response program to save even more money. They tell us that most customers with a Nest save between 10 and 20% on their bills over the course of the year. So allows you to control your bills, save energy, save money, and consumersenergy.com/free thermostat.
So we can do that right today.
Right today.
Right today. Thank you for that. Just as we move forward today, we want to thank you all for joining us. Be reminded that next week we'll be right back here. There are a couple of webinars when you go in that you can connect to, and we have a lot of information. Unfortunately, as you can see, more information than we can get in an hour, but we appreciate you. So we want you to come back, continue to load those questions in because we'll stay on for a few minutes following the closing of the webinar so we can respond to those questions. We want you to visit our website, and we also want you to include additional questions on the survey that will come up immediately following today. That survey, that little evaluation should only take you about a minute to complete. But we want to let you know that the Healthy Flint Research Coordinating Center and all the partners that participate in this webinar every week are taking the information back. The hospitals are on, our community organizations are on to make sure that we're providing the best information that we absolutely can for you. So we want to thank you today for tuning into this webinar. And we want to again say, let us know what your interests and concerns are, and we will be happy to work to answer them. So let me say one more time, join us next week right here for the Flint Community Webinar on coronavirus. Thank you.